morning, Mrs. Stepani. I'm Bridget Shaw. I'll be your nurse practitioner today. Is it okay if I examine you? I'm going to just wash my hands real quick and we'll get started. Do you have any concerns today? No? No? All right. Nice to meet you. You too. I'm going to just get started with a full body exam. So I'll start from your head to your toes. I'll ask you to do some funny things, but we're just checking all your systems today. Okay. I'm going to start by looking at your scalp and your hair just to make sure there's no lesions or bumps or scabs. Anything hurting or itching? Nope. No, that looks good. Do you have any problems with your sinuses? Or I'm going to go ahead and feel all your sinuses here. Any pain here when I do that? No? All right, good. And looking just for some skin lesions to see if everything looks okay. That's looking really good. Okay. I'm going to go ahead and take a look at your eyes. And normally we would dim the lights a little bit at this point. And I'm going to make sure that your eyes, your pupils, that they react and they accommodate to the light. Okay. I'll have you just stare straight ahead. And I'm going to go on to this side. Good. I'm also going to come up a little bit closer. I'm going to look for a red reflex in your eye to make sure that your eye is doing good. Good, and that's there. Good, red reflex. Good, your eyes look healthy. All right. And I'm going to also look into your ears. Are you having any problems with your ears at all? Nope. No? Okay. I'm going to just inspect the outside of your ears, make sure there's no lesions or anything. It looks good. Any pain when I pull on it or anything? No? Okay. And then I'm going to go ahead and look in here with this otoscope. And I see your eardrum, your tympanic membrane, and it looks good and healthy. I'm going to go over on this side here. Good. A little bit of cerumen in this ear, a little bit of earwax, but I can still see your tympanic membrane. That looks good. No lesions or anything that I can see. I'm also going to go ahead and take a look at your eyes and your eyelids. Any problems with your eyelids at all? No. Good. I'm also going to do some cranial nerve testing with your eyes. So what I'm going to have you do is look straight ahead. And I'm going to put 2 fingers up, and I want you to let me know what fingers, and go ahead and close, yes, one of your eyes. So let me know how many fingers am I holding up. 2, 1. Okay, go ahead and cover your other eye. And this is just checking some of your peripheral vision. Go ahead again. 1, 2, 1, 2, 2. Good, very good. Now I'm going to check for the ocular motor function of your eyes. So I'm going to have you follow my finger and not move your head. Great, good job. Everything looks good there. And now I'm going to start by looking into your nose as well. Have you had any problems with your nose at all? No. I'm going to go ahead and plug this side and go in and inhale. And this side, inhale. Good. It sounds like it's patent. And then I'm going to also go ahead and take a look in the nose. So I'm going to have you lift your head up a little bit. And I'm going to just take this a little bit and take a peek. Good, that looks good. I know that's uncomfortable, but it looks good, and it's pink and it's moist, exactly how it should be. Okay, so now I'm going to go ahead and look into your mouth. Are you having any problems with your teeth or anything like that? No. Any sores on your lips, mouth that you're aware of? No. Okay. I'm going to have you go ahead and open your mouth. Good. Your buccal cheeks look good. Your teeth look good. Doesn't feel like there's anything loose. Go ahead and go, ah. Good, everything's functioning good. And now what I want you to do is go ahead and stick your tongue out and side to side. And this is also checking some of the cranial nerves. That's why we do that. Good. And now can you go ahead and puff your cheek? Okay, and then what I want you to do, you can go ahead and let go. I'm going to check some of your neck as well, and then the cranial nerves for the function here too. So I'm going to have you press against my hand and turn your head. There you go, good. And this way, good. All right, perfect. And then can you go ahead and squeeze your eyes shut really tight? Good. And smile big. All right, you can open your eyes. Okay, good. That's just checking some of your cranial nerves as well. Now I'm going to do some of your neck nerves, and then that will, I'm going to have you shrug your shoulders. Go ahead and shrug them, and then try to hold me. Good, perfect. And I'm going to check some of your range of motion of your neck. So can you look left and right for me? And then up and down. Any pain with any of that? No. Can you do side to side with your neck? Perfect. Good. Good job there. All right. And now I'm going to go ahead and feel some of your lymph nodes and your neck and your thyroid. So we want to make sure that those all feel okay. You have a lot of lymph nodes. I'm going to touch back here behind, and I'm going to have you lift your head up just a little bit. And then these are the occipital ones, and I just want to make sure there's nothing inflamed. And I'm going to go post-auricular, pre-auricular, and then up into your jaw, submandibular. Good. They feel good. What we don't want to do is feel a lot of the inflammation or of the lymph nodes. Yours is feeling good, and then we do deep neck ones. Good. Good. I'm also going to feel your temporomandible joint here. I'm going to have you go ahead and open your mouth wide. Okay, and go ahead and close. And then shift your mouth from side to side. You do have some popping in there. You're probably used to having some TMJ. I can definitely feel that. All right, good. So now what we're going to do is we are going to, all right. I think I'm going to go ahead and start listening to your lungs and take a peek at your lungs over here and watch the way that you breathe. So I'm going to come around here to the back, and I'm going to just untie your gown just a little bit. And do you have any problems with your back as far as breathing? Any discomfort when you're breathing at all? No. I'm also going to look at your skin to make sure that there's no suspicious lesions, and I don't see anything that stands out to me. And I'm going to go ahead and feel your spine here, the spinal processes here, just to make sure there doesn't have any abnormalities. And I'm going to come down on the sides here too. Let me know, if you have any pain or discomfort when I'm doing any of this. Good. And I'm going to go ahead and palpate. I'm going to do it right on the side here, and this is to let me know if you feel anything painful. This is to test it, make sure your kidneys are okay and that you're not having any problems with your kidneys, okay? And now it's going to feel funny. I'm going to be tapping on your back. It's called percussion, just to make sure that there's nothing going on there. With your lungs, we listen for a dullness or tympany to see if there's any lung problems at all. Too much air in the lungs, some dense lung tissue, that's what we're looking for here. All right, so it's sounding okay. And I'm going to go ahead and listen. I'm going to auscultate all these areas. When you feel the stethoscope on your back, I'd like you to take a nice deep breath for me, okay? Okay. And typically, this would all be done on direct skin. Good. Great. I'm also you're going to feel me touching your back, and I'm going to have you take a deep breath because I'm going to just check for the expansion. Go ahead and take a nice deep breath. And relax. Very good. Good. All right, I'm going to come around to the front here. And I'm also going to listen to your chest and listen to your lungs. And again, everything would be direct skin, but we'll kind of keep you covered as much as possible. your heart 2 different ways while you're sitting up, and then later I'll listen to it again when you're lying down, okay? And I'm going to go ahead and take a listen now. Any chest pain or any problems like that? And what we like to do is listen to all the areas of the lungs, the aorta. And we like to listen to the pulmonic. The second pulmonic. I'm listening for any murmurs or anything. Sounds good. Do you have a history of murmurs?
No.
I'm going to listen to the tricuspid. And the mitral valve. Good. Sounds good. All right. I'm also going to go ahead and feel your thyroid. I'm just going to touch here on your neck and feel. And just kind of observe. Go ahead and swallow for me. Good. And swallow. Good. And now I'm going to feel while you swallow. Sometimes we'll have the patient take a sip of water if it's hard for them to swallow. Go ahead and swallow. Good. And what we're looking for is an abnormally large thyroid when you swallow. That feels good. Good. And I'm going to go ahead and feel your lymph nodes here too, trabecular lymph nodes. And those feel good. Good. All right. And we'll move on here. Okay, so now I'm going to go ahead and have you lay back all the way. And I'm going to listen to your heart while you're laying back this time. Again, in all of those 4 areas, or 5 areas. I'm going to just pull this down just a little bit. I'm going to listen here. Sounds good. All right. And also, now I'm going to go ahead and listen to your stomach as well. We can go ahead and pull, I know you have shorts up, we'll pull this up so we can kind of visualize your stomach here. And I'm going to listen first, and then I'm going to palpate it and percuss it, and just to check for dullness and some densities in there. Are you having any problems with your stomach at all?
No.
And I'm going to check for breweries too, with the bell of the stethoscope when I'm down here for the aorta. I'm going to listen to that first. Sounds good. Now I'm going to finish by listening to all your vowel sounds here. Vowel sounds are definitely there, but not too much. Very good. Now you're going to feel that tapping on you again. And this is percussion, and it helps with figuring out the organs and that they're the correct sizes. So you're going to feel that. Shouldn't hurt. If anything does hurt, please let me know. Normally this would all be done on direct skin. Good, very good. And now you're going to feel me touch you. I'm just going to kind of gently feel your stomach. Any tenderness? Mm-hmm. And I'm going to go up here and feel the liver. Any tenderness? Very good. Good. All right, I'm going to go ahead and have have you sit back up. And I'm gonna, I didn't see any lesions or anything on your stomach. The whole exam, I like to look at all of your skin just to make sure that nothing stands out to me as being suspicious. So I didn't see any on your arms or your back or your stomach, so everything is looking good. I'm also gonna do a test just to check your sensation too on some of your extremities here. So we have a sharp, this is sharp, and then this is dull. Okay, I'm gonna have you close your eyes and you let me know what you feel and what arm or extremity that you feel that in, okay?
Left sharp, left sharp, right soft, right soft, right sharp, left soft, right sharp, left sharp, left soft, right sharp, left sharp, left soft, right soft.
Good, and that helps check some of your cranial nerves also, okay? Good, and now I'm gonna go ahead and check some of your reflexes just to make sure everything is working okay as well. I'm gonna start up here on your arm, and we've got the brachial one here, and you're just gonna feel that tapping. Okay. Good. And on this side here. Good, and right here. Yeah, that one really worked. The brachioradialis is that one. I'm also going to check for your tricep back here. So this one's a little bit awkward here. So try to relax your arm. Good. And I'm going to this one here. Go ahead and relax your arm as much as you can. Good. All right, perfect. And then I'm going to go ahead and have you hold your hands and look straight ahead. And then here. Good. And I'm going to go down here by your Achilles tendon here, and I'm going to check that. All right, and then this one. Good, and your plantar. Sorry, that tickles a little bit. Good. Go ahead and you can yes. And your legs, are you having any problems with your legs at all?
No.
Skin looks good. Doesn't feel like you have any swelling or edema. I'm going to go ahead and check your pulses down here as well. Dorsal pedis here. And good. Good. You got pulses down in here too. Good. Well, your skin looks good. I'm going to go ahead and check and make sure that your blood flow is good. This is a capillary refill that we check. Looks good. All right. And what I'm going to have you do is, I'm going to have you, let's see, we'll check your feet here and just make sure your strengths of your feet also. So I'm going to have you push up onto my hands, kind of against, yeah, and then push down. Perfect. I'm going to have you take your hands back and forth, good. And then I'm going to have you grip my fingers. This all helps with grips and the cranial nerves and making sure everything is functioning, perfect. And I'm going to push your hands down. Go ahead and put your hands like that, and I'm going to push them down, don't let me. Okay, I'm going to push them up, don't let me. Very good. That feels really good and strong. Well, good. Now I'm going to have you stand up. I'm going to see how you walk. Is this tall, too tall?
Yep.
I'm going to have you walk towards the door, and I want you to put one foot in front of the other and go ahead and walk straight. This is just checking your balance and coordination, and then I'll have you come back to me. Very good. All right. And then what I'm going to do is I'm going to have you face the door again, and I'm going to have you bend over. I'm going to just look at your spine and just make sure that there is no curvatures in your spine and that it all looks good. I don't see any curvatures. Good. All right, go ahead and have a seat again. Okay, and then there's one more check that I want to see for the function of your cerebral function is I'm gonna have you take your heel and rub it down the shin of your leg. Good, and I'll have you do the same with the other one. Good, that's all good, that's all intact. Good. Okay, there's just a couple more tests and then we'll be done. I just wanted to check a little bit more of the cerebral intactment. So I want to go ahead and have you touch your nose, and then you're going to touch my finger, okay? So go ahead and touch your nose, touch my finger. Keep doing it, touch your nose, touch my finger. Perfect, all right, good. And then also I want to go ahead and I wanted to feel your heart one more time. I just want to make sure that you're not having any thrills or heaves, so I want to go ahead and have you lay back down. I know I listened to it, it did sound really good, but I just want to make sure that I don't feel anything abnormal as well. So I'm going to go ahead and press my hand here and just make sure that there's nothing heaves, lifts. And that all feels good. Good. Okay. Oh, and I'm sorry, I'm not quite yet. I just want to look at one more thing. I want to look at your neck. I'm going to have you turn your head to the left a little bit. And I'm just actually looking at your jugular vein to see the pulsations, to see if there's any extension or bulging, and it looks good. And then I'm going to come around to this side and look at it too. Go ahead and turn. And we just want to make sure that it's not fully extending and that it's pulsating properly. Perfect. Okay, now I'll have you go ahead and sit up. And do you have any questions or concerns?
No.
Well, good. It was nice meeting you.
It was nice to meet you
Everything seems to be within range, and then you call us if you need us for anything.
Great, thank you.